sometimes. Moving on to the basic case report data which I am going to be presenting. So she's a 9-year-old girl who reported with a history of trauma while playing with her sister. She hit the wall and fractured her central incisor. So this clinical finding, and they had the awareness of at least calling a dental clinic or calling their dentist to ask if this can be fixed within 20 minutes of time, and they reported with an intact broken tooth fragment. So we diagnosed it as unconglomerate crown fracture because it did not involve the pulp, it involved only enamel and dentine. And the treatment plan, since they had the intact tooth fragment, we moved ahead with a fragment reattachment procedure. So the treatment protocol, basic treatment protocol which I carried out was, first you have visually examined the trauma region and the tooth fragment. Both has to be intact. We have inspected the fracture line, followed by rehydrating the fragment. We'll come to it, why is it so important in the case. Followed by isolating the tooth and beveling the tooth structure, etching the tooth fragment and tooth structure, and then rinsing the tooth surface, washing away the etching solution, basic procedure of a composite restoration. Finally bond the tooth fragment and composite. So ideally, how do we do is, once we inspected the fracture line and the fractured fragment, a selective etch has to be done, which is only the enamel surface needs to be etched. We don't have to go for a total etching technique, also why we will discuss in the future slides. And then we go for placing a flowable composite, then finally reattach and cure, followed by polishing, inspecting and final inspection of the tooth fragment. So this is the before, and it looks like I have amazingly done a composite restoration, but it is not that. It is just that the tooth fragment which came to me was attached or attached to this natural tooth structure. So this is another case of my colleague to just show if in case there is a complicated crown fracture where a pulp is also involved, a pulpotomy, cervical pulpotomy has been done, and these are the two fragments which has been placed and been replaced in a similar case. So now discussing the critical points of this case are, first thing, when I said rehydration of fragment. So we have enamel rods, enamel prisms, and saliva is an amazing rehydrating solution or liquid in our oral cavity. When it is out of the oral cavity, even for a few minutes, it tends to discolor. So what do we do? According to the International Association of Dental Traumatology, the guideline says 20 minutes of rehydration in distilled water or saline is more than enough. So in this case, I gave it another 10 minutes, so 30 minutes of rehydration of the fragment was done, and that 30 minutes time also gives us preparation to prepare our other necessities for the case, because when a dental trauma case arrives, we generally don't have everything handy, so we just have to keep and arrange the. So they also say calm down the patient, calm down the parent, and then proceed further. So they also say